What diagnostic tests find squamous cell bladder cancer? If you're wondering how squamous cell carcinoma of the bladder is diagnosed, you're not alone. This type of bladder cancer is identified through a series of tests that help doctors evaluate the condition accurately. Let's break down these diagnostic methods in a straightforward way. First up are urine tests. A urinalysis is often the first step. This test checks for blood in the urine, known as hematuria, which can be an early sign of bladder cancer. It examines the physical, chemical, and microscopic characteristics of urine to spot any abnormalities. Another urine test is urine cytology, which looks for cancerous cells that may have been shed from the bladder lining. While this test can be helpful, it may not always detect low-grade tumors effectively. Additionally, there are urine-based biomarker tests that measure specific cancer-related markers. These tests can assist in detection, but are usually used alongside other methods rather than as standalone diagnostics. Next, we have cystoscopy, which is a key diagnostic tool. During this procedure, a thin, lighted tube called a cystoscope is inserted through the urethra to visually inspect the bladder lining. This allows doctors to see any suspicious areas directly and take biopsies if needed. Speaking of biopsies, this is a crucial step in confirming a diagnosis. Tissue samples are collected during cystoscopy or through a procedure called transurethral resection of bladder tumor. A pathologist then examines these samples under a microscope. This examination confirms whether squamous cell carcinoma is present, assesses the tumor grade, and evaluates how deeply the cancer has invaded the bladder wall. This information is vital for staging the cancer and planning appropriate treatment. After a diagnosis is made, imaging tests come into play. Tests like computed tomography scans, magnetic resonance imaging, positron emission tomography scans, bone scans, and chest X-rays can help determine how far the cancer has spread. These imaging techniques are essential for understanding whether the cancer has affected nearby tissues, lymph nodes, or other organs. In summary, diagnosing squamous cell bladder cancer involves a combination of urine tests, cystoscopy with biopsy, and imaging studies. While urine tests and imaging are important, the definitive diagnosis relies on the cystoscopy and biopsy results. This structured approach aligns with established standards for bladder health and cancer management, ensuring that patients receive accurate diagnoses and appropriate treatment plans. Always consult with healthcare professionals for personalized advice and information tailored to your specific situation.